Joining me is Peter Wright, the CEO of Valley Regional Hospital. So, we were talking about your strategic plan, but I want to kind of, how does the Affordable Care Act, the ACA, affect your whole thought process? That's sort of one issue, and I want to set up sort of the other one is, the Medicaid Expansion Act in New Hampshire is going to be looked at in 2016. And I want to know sort of your sense on where that ought to go. Those are the two things I want to kind of get at, and sure. I'll throw them both out now, and you can pick whichever one.
So we'll start with the Affordable Care Act. Last year, most people know that we were excluded from the exchange. Anthem Blue Cross was the only provider.
And a lot of hospitals were.
Yeah, there were 10 hospitals across the state. We did a lot of advocacy across the state with our peers. New Hampshire was actually looked at as the worst situation in the nation, so there was a lot of national attention. CMS changed the rules about essential community providers, which essentially made them include us in the network. They'd have you think otherwise. But we're very proud to say we advocated not for ourselves, but for our patients to be able to get care locally. Now they can choose wherever they want to go. This year there's 5 providers. We have contracts with 4 of them. We don't have a contract with Minuteman out of Massachusetts. As we looked at it, they weren't able to put together an adequate network. So it's one thing to have a contract with us, but we want to make sure that people can get care beyond us. And we just didn't see that coming together. But the big players, again, will be Anthem Blue Cross, Harvard Pilgrims, Elevate Health, and there's one out of Maine and a 4th that we have contracts with. So there's lots of choice, and I think that's the most important thing.
And do you think that will more people use that vehicle to get insurance?
It's a fact. I think the availability of insurance is much better than it used to be. We know that when patients have insurance, they're more likely to seek care, but they're more likely to seek preventive care. So when you don't have insurance, you wait and wait and wait and suck it up, if you will. Then by that time, it's not only more difficult to provide that care, more severe, it's more costly. So we know that because people have insurance, they're more likely to get the preventive primary care that they need, and that hopefully reduces the emergency and more expensive care.
And so the other issue was the Medicaid expansion.
I personally am a fan of Medicaid expansion, again, not because of the politics behind it, but the more people that have access to insurance means they'll seek care earlier. They'll seek more primary preventive care. The whole concept of what we need to drive towards is keeping people healthy. And we know, and all the studies show, if they have insurance, they're more likely to get primary care. That's where I use the garbage can analogy. If you start a little fire in a garbage can, I can take a cup of water and pour it out and it's done, right? You deal with the issue in the beginning, it's small. If you let it there, if you ignore it, you let it fester, it goes up the wall and engulfs the room, and now you need a totally different level of resources to deal with that fire.
So let me, on this, but slightly different. If there were one reform in the Affordable Care Act that you would want to pitch, what would that be?
Geez.
Sorry to get you off balance.
No,
there.
that's okay. It's complicated. Just the access to insurance, I think, is the best thing. I strongly encourage especially when you're young. When you're young, you're healthy. I don't need insurance. I'm fine. I'm not sick. I'm that way. I don't use my insurance hardly at all. I go see my primary care provider, but I exercise and I eat right and stay on top of things. So I don't use the healthcare system that much. That said, when I have an issue, it's nice to know I have insurance. So, right now I have a bum knee, so I'm getting a little bit of PT, I'm addressing it early, and it's not going to be a big deal and it's not going to be expensive. I probably would hold off if I didn't have insurance. So I think that's the biggest part, whether it's insurance on the exchange, whether it's, expanded Medicaid, folks having insurance is just really important.
Has the Act caused hospitals to change dramatically the way they do business?
Certainly. I think it was happening before. I think the development of high deductible plans is a double-edged sword. It means more out of pocket for the individual. And so again, more out of pocket makes people wait, but that wait is actually sometimes very good. It means we have skin in the game. Before high deductible, before the ACA, people just said, I think I want an MRI. And the internet drove that as well. The more knowledge that we have and we can research, and we've had patients come in and say, I want an MRI, I want a CAT scan, I want this test, I want that test. And our providers are like, but but that's not appropriate. You don't need that. You know, there's a gap of information. Now that we have high deductible plans, it forces patients to think a little bit more about what's necessary. And there's always that fine line about...
But they'd always get the right advice if their doctor says this is necessary.
Right.
So, you know, Peter, we're out of time in this segment. Thanks so much for joining us.
My pleasure.